I'm running a little late. I'm Helen Mason, Chief Executive of the Plenty District Health Board, and I'm speaking on behalf of the Chief Executives of District Health Boards around the country. What I'll do is I will make a brief statement, and then there'll be an opportunity for questions. So as you'll be aware, we've been in facilitation, and we've been in facilitation with the Employment Relations Authority, and we are still in facilitation. Facilitation is ongoing. That we're currently waiting to receive the final recommendations from ERA, and we're anticipating that we'll get those final recommendations shortly. That we're very disappointed to be advised that NZNO is going ahead with a strike. We are awaiting the final recommendations from the ERA facilitator, and we're very disappointed that strike action is going ahead, given that we have yet to receive those final recommendations and neither party's had an opportunity to review the recommendations. DHBs look forward to receiving the final recommendations from the facilitator, and we will be taking those recommendations very seriously and considering them very seriously. And we'll be taking our time over that, but we're pleased that we've had the opportunity to work with the facilitator, and the facilitator has considered the matters from both parties' perspectives, is very, very well versed in the issues, has absolutely heard nurses' concerns, as have DHBs. We've been working very hard over the last 24 hours to try and find resolution, and DHBs will continue to find and to work very hard to find a way forward with this. In the interim, as you're all aware, we have been very, very focused on planning for strike action. And what I'd like to do is I'd like to take this opportunity to reiterate the messages to our public that DHBs have been working for about 3 months, on ensuring that should industrial action go ahead, that DHBs are very, very well prepared. Those efforts have been led by our most senior clinicians. And so the public, I'm keen for the public to know that senior clinicians have been working on those plans for an extended period of time. People will be able to access information from their local DHBs, but what I would do is I would urge anybody who has an urgent medical need to not hesitate to attend an emergency department, to not hesitate to dial 111 and call an ambulance. The other thing is, for more usual day-to-day medical queries, can people please remember that they have the option of contacting their GPs, of contacting local pharmacists, and also using the 0800 Healthline number. Thanks very much.
From the beginning of that facilitation process, was it made fairly clear to you by nurses that they had no intention of ceasing the strike action?
So the facilitation process is ongoing, and the facilitation process is a confidential process, so I'm not going to comment on the confidential
process. Are the nurses
process.
Still part of the facilitation?
We're waiting for final recommendations, and both parties involved in the facilitation are waiting for final recommendations from ERA.
Is there any indication around timing for those final recommendations? Could it likely be tomorrow during the 24-hour strikes?
I remain optimistic that we'll get those recommendations in the near future. I don't have a time, and it's absolutely up to the ERA facilitator. But the ERA facilitator was very aware of the pending industrial action.
Sorry, are we talking hours, minutes?
I can't presuppose. It sits entirely with the facilitator, and it depends on the facilitator having the opportunity to develop recommendations and go through appropriate processes, and so we need to leave that with the facilitator. I'm not going to second guess how long it's going to take her to get the recommendations to us.
Does either party, the DHBs or the union, have to follow the recommendations from the EPA facility?
The process is that the facilitator will make recommendations. Those recommendations aren't binding on the parties. What I will say is that from a DHB perspective, we're very pleased to have had another third party who has looked at the DHB offer. We had previously had the independent panel look at the DHB offer. So we are pleased that ERA has looked at it, and when we do get their recommendations, we're going to be looking at those recommendations very seriously.
So the nurses are still in facilitation because they're required to be?
The facilitation process is ongoing because we haven't received recommendations.
But did the nurses walk out of facilitation? Did the talks break down in the sense that the nurses left them today?
Again, I'm not going to comment on facilitation. It's a confidential process.
When you say it's ongoing, when are you likely to meet again then? So if facilitation is ongoing and you get these recommendations, you consider it, and what's the next step? Because if you get recommendations, it's ongoing, it seems to have stopped.
The process from here is for us to receive the recommendations from the facilitator, and for both parties to receive those recommendations, and then for both parties to have the opportunity to consider those recommendations and consider their response to the recommendations. And DHBs are really looking forward to receiving the recommendations, and will be considering them very, very seriously.
So the strike tomorrow, which is planned to start at 7 a.m, will it be definitely going ahead, because it is quite late now?
We're very disappointed that there's been an announcement that the strike is going ahead, given the fact that we don't have the recommendations yet.
So who's made that announcement?
That it's been reported in the press.
But has the nurses' organisation confirmed that to you, said that to you, that the strike will definitely go ahead? Are you relying on the media or the nurses?
My understanding is that they put out a statement advising that it will go ahead.
Do you think the whole facilitation process to this point has been fruitless, considering the fact that the strike is still going ahead?
I think the facilitation process has been very, very helpful, and I think it's extremely helpful to have a third party looking at an offer. I think it's extremely helpful to have a third party who's assessing that offer, who is listening to the concerns of both parties and then assessing whether the offer actually addresses the concerns of both parties or the perspectives of both parties.
Do you feel like that's being done?
I think the facilitator has worked very hard. I think it's been an extremely robust process, and the facilitator has strongly heard the concerns of NZNO, has strongly heard the concerns of nurses, not only in respect of pay but also in respect of working conditions.
So let's say those recommendations come out in the middle of the strike tomorrow. What do you do then? Do you ring the nurses organisation and say, hey, can we step back from the strike for a bit and have a look at these recommendations? Could we potentially stop halfway? How would that work?
I think that we need to consider the recommendations when they come out, and then we'll be determining next steps. So I don't have a definite answer for you on what will happen when we get the recommendations.
What are we considering the recommendations for?
This is what we're looking at. In terms of the industrial action tomorrow, we're looking at an unprecedented circumstance for the country. It's the first time in 30 years that there will be a national nurses' strike. DHBs have been working extremely hard to find resolution to this, to avoid that industrial action. And our reasons for wanting to avoid the industrial action is we take our accountabilities of keeping patients safe very, very seriously. At the same time, we take our accountabilities for keeping our staff safe as well. So when DHBs do receive those recommendations, we will be considering those recommendations immediately. So we're waiting for them to come, and we've been working very hard trying to get the recommendations, and we will be paying full attention when the recommendations come through.
So considering all of that, and that once again the strike is still going ahead, what would your message be to nurses directly right now? My message is more to the public at the moment, and so my message to the public is that DHBs have worked very, very hard to find resolution. The thing that the public is most interested in at the moment is ensuring that they will have access to emergency and essential services tomorrow during the strike. And I would like people to know that we have worked very hard to ensure that there will be safe access to services tomorrow. So nurses are essentially the cornerstone of the health system. They are highly respected and very, very well regarded members of the health system. It's hard to replace nurses when 70% of your workforce goes out. What I will say is that nurses, we have on the contingency planning, we have been working very hard with NZNO on ensuring that there are appropriate plans in place, and we will have nurses as well as other medical professions working tomorrow. There will in fact be members of NZNO who will be providing life-preserving services, and my message to everybody who's going to be working through the industrial action, regardless of whether they are NZNO members or not, I want to thank everybody for the work that they will be doing tomorrow and the focus that they will have on keeping our community safe. We've also had many staff who have been working very hard on the contingency planning over an extended period of time, and I have today recognised their efforts and put out a thank you to them on behalf of the New Zealand public, because they've been working very hard to keep the public safe during this unprecedented disruption to services.
Are you confident that everything that could be done has been done, and so that anyone who's in hospital or needs to be in hospital tomorrow will be safe?
That it is unprecedented, the action that we're looking at tomorrow. We've been working extremely hard to ensure that there is robust access to essential and urgent services. As I said, that our contingency planning efforts have been led by by our senior clinicians, who at the forefront of their minds is patient safety. That many of you yesterday were with me with Dr. John Tate,
and Dr. Tate's messages were care will be provided. It might be slower than in other circumstances, but for essential and emergency services, care will be available.
I'm wondering, we keep hearing the word unprecedented, and this hasn't exactly been a process in a stroke that's just been decided on, you know, that it's just happening overnight. This has been spoken of for a while. How unprecedented is it if you have had time to consider contingency plans and known it was going to happen?
That I'm trying to think how I can convey the complexity of contingency planning. DHBs have been working on contingency plans for 3 months. Those and working with NZNO. Those efforts have intensified over the course of the last month, and as we get closer to industrial action, intensified even further. Essentially not having 70% of your workforce in the workplace is a really significant challenge, that you don't address that easily.
It's 14 hours till the strike. What do you think the chances are now of it going ahead?
That I'm going to look forward to receiving the recommendations from the facilitator.
Did they give any time, any indication of time?
I think I've commented on that, that I'm not going to second guess the facilitator. The facilitator needs to take the time to, and the facilitator, our understanding is the facilitator will be working very hard to make recommendations that they believe are the best way forward with this.
Considering all the work you've been pouring into this, this must be for you incredibly frustrating that still we're at this point. Are you finding it incredibly frustrating?
I'm very disappointed that we are looking at strike action tomorrow, given the fact that we haven't received recommendations yet. It is very disappointing. My primary concern as a chief executive of DHB, and on behalf of chief executives around the country, our primary concern now is patient and staff safety. That's what we're focused on. Thank you.
Just one quick question. When the recommendations do come through, do you guys have a plan in place for what you need to do to pull the strike action, or how does it work? Do you ring up the NZO? How does that go about? And surely you guys have got a plan for when it lands on your desk.
The thing that we're waiting for at the moment is to get the recommendations. And then things will unfold from there. We need to understand what the recommendations are, and we need to consider those recommendations, and that will inform what our next actions are. So, and I'm sorry, we are still in facilitation, so I'm going to draw this to a close. Thank you very much indeed again for being here, and my final message is around DHBs are really focused on keeping both patients and staff safe should industrial action go ahead. For anybody who has an urgent medical need, please do not hesitate to dial 111. Please do not hesitate to attend an emergency department. The clinicians are working really hard to ensure your safety. Thanks very much. Thanks.
Thank you.
Look, I'm sorry, the decision hasn't been